So you think obesity is also one of the reasons for causing hernia? So what do you think is the most common cause for these hernias to occur?
Smoking is a risk factor.
Hernia occurs only in older people, is it? Hernia is more a male thing.
Yes.
It affects the men more and it bothers the men more. So how much does it bother a woman? So hello everyone. Here we have Dr. Sethukannan, who is a specialized surgeon. His super specialization is in hernia. I would like to talk to you only about hernia. Hello,
Okay.
welcome doctor.
Welcome, ma'am.
I would like to know first to begin with, like when hernia is a very common term, very roughly used also. And as per description in the dictionary, it's a little different. But as a doctor, what would you say a hernia would be?
Basically, a hernia is a defect in the anterior abdominal wall
Okay.
through which this abdominal content, either a fat or a
Okay.
bubble, pushes out through that defect and comes out, and
Okay.
it is getting visible in the anterior abdominal wall.
Okay.
That
So it
is
can be anywhere up also, down also,
down also.
anywhere.
It can be anywhere in the anterior abdominal wall. Hernia is a broad term, but we will stick on to only anterior abdominal wall hernias.
So, I mean, there are types of hernia, right?
Yes.
So, would you like to describe something more on that?
Yeah. When it comes to anterior abdominal wall hernias, if it is occurring in the inguinal region, which is where the abdomen meets the thigh, the portion where this hernia occurs, then it is a inguinal
That is
hernia.
the thigh crease, which call
Yeah,
okay.
above the thigh crease, it is
Yeah.
a inguinal hernia.
Okay.
And if it is occurring in the belly button,
Okay.
then it is umbilical hernia.
Okay.
And somewhere in the abdomen, other than this part, it is a ventral hernia.
Okay.
And there is another portion called as spigelian hernia.
Okay.
All this are covered under anterior abdominal wall hernias.
So, what do you think is the most common cause for these hernias to occur?
So when we say about the cause of for this hernia, it is only the two things. There is a weaker portion in the abdominal wall,
Okay.
and there is a constant pressure, which is causing that weaker portion to develop into a sac and form into a hernia. So that is what the basic cause for that, and there are multiple reasons which is causing that.
So, you think obesity is also one of the reasons for causing hernia?
Yes, ma'am. So obesity, sudden weight gain is a risk factor, where this muscle, the fat deposition in the muscle is that is occurring all of a sudden, and this muscle gets weakened. So obesity is a risk factor for developing a hernia.
So, when it comes to the rectus dye verification, that's a very common term also used. I think I don't remember the term now. It's so common. It was there all over the internet. You have to do abdominal exercises for that. So that can also cause herniation, right?
Yes, ma'am. So diverification of recti is not hernia actually.
Okay. Yeah.
Because there is no formed sac.
Okay.
But this recti muscle, when you see in six packs, there is a central line, a linea alba, that gets spread out, so that the content comes and sees a weaker point and it goes and stays there. But there is no formed sac to say that it is a hernia.
Okay. Okay, so that's different. And
that's
this is different.
Totally a different entity. But diverification of recti can be corrected sometimes if it is occurring after pregnancy through exercise, core muscle exercise, it can be reverted also.
Okay. And now many people try to reduce it and then they push it inside and all. So it's a physical this thing they believe, and then they wear a tight belt or abdominal belt around it, or a hernia belt which is going to lift it up and push it up. So will that be helpful?
Once the hernia is formed, this abdominal belt or any belt is not going to help. But in a postpartum period, that is after delivery, we do advise abdominal belt. Okay. It prevents from diverification of recti as well as herniation of umbilical hernia of such kind. It helps now.
Okay.
Also, any previous surgery in the abdomen can cause weakness in the surgical site, and it can cause hernia, that is called as insertional hernia. It can occur in anywhere in the abdomen.
And now when we talk about hernia, now there are various stages for this, right? So it initially starts as a small thing, and then please let us know when the surgery is required. So let's start with when the person should get alerted and say, I need to see a doctor.
So when it comes to hernia, what time to operate? Most of the patient ask me, when is the best time for me to operate?
Yeah.
So ideally, a hernia has to be operated. That
Okay.
is that defect or a hole cannot be rectified by exercise or by any medication. So it has to be ideally operated. The sooner will be the better.
Okay.
So
So even if
because
you see it very early also, you should get operated.
we usually operate, ma'am,
Okay.
because waiting for a longer time doesn't going to correct this defect.
Okay.
But only condition where we wait for the hernia to revert is umbilical hernia in a pediatric age group. For a preterm baby, if there is an umbilical hernia, then we will go for wait and watch, because by 2 years most of the hernia will close by itself.
Okay.
And after wait and watch time is even prolonged. This pediatric surgeons even prolong it to 4 to 5 years.
Okay.
So they wait till 4 to 5 years. If it is not getting close, then we
So in
operate.
children it can close all by itself, but in
always.
adults that's not a
That's not
possibility.
but even in children, if it is a inguinal hernia,
Okay,
then
then it has to be
be done as soon as possible.
Okay. Why do you think the inguinal hernia is so, scary kind of? Because you're saying you have to operate early or as soon as possible.
Because the umbilical hernia will not close by itself, ma'am. Because of the preformed sac which comes when the testis descend down to the scrotum. By 7 years it comes to the superficial ring. It has to transfer to the abdominal muscle and has to come to the scrotum. In a preformed baby, when it comes, it has to get obliterated. If it is not obliterating, it forms a sac.
What do you mean by obliterating? I mean,
Obliterate,
for
it
the
has
people to know.
it has to get closed.
Yeah.
So if it is not closing, it will form a sac, so that this bowel content or momentum can come through it. And a baby, if this bowel content is coming through it and is getting obstructed, for a baby it is not possible to see, and the baby will be crying for a longer time, and for us to identify it will get delayed. But it is not in a case in umbilical hernia. Umbilical hernia, it is very obvious, and it can be clinically identified if it goes for obstruction. So that is why for umbilical hernia we used to wait if it is in a pediatric age group still 4 to 5 years. For inguinal hernia, we will operate it as soon as
babies
possible.
also, you have to operate,
also,
all the more you have to operate faster
operate it
because of the descent of the
the
testis. Which has to
only difference between pediatric and adult will be, for adult we have to place a mesh to reinforce the muscle, but for pediatric we don't keep a mesh. We just ligate the sac and do a
just close
herniatomy alone.
yes. But in you're talking only about male babies. In female babies?
Female babies also it is possible to develop inguinal hernia and umbilical hernia. But the content will be different. It will be a round ligament in a female hernia.
And what about this abdominal belts in general? Do they help?
Abdominal belts doesn't help.
But there are hernia belts also,
yes,
right?
Ma'am, there are a lot of hernia belts.
Yes.
But it is not going to cure the process, but most of them use it for a comfort. So that this is not bulging out, this is not.
So the pain factor is taken care
of.
Usually they complain of a dragging pain, which is
the
botheration.
So that gives them some comfort. Most of them are using it.
But using a belt doesn't mean that the complication, that is obstruction, will be taken care of. Does that happen?
No, ma'am. No, actually, if it is a irreducible hernia and if they are going to use this belt, it is going to cause even more problem.
Okay.
It is going to strangulate from both sides.
Yeah.
That will be a problem. So ideally, I don't advise to go for a hernia belts.
So we have heard about in length about what hernia is and what causes it and stuff like that. Can you just enlist the risk factors? Like if a person can take care of these things, probably a hernia can be avoided. So is there something like that?
Yes, ma'am.
Okay.
So when age advances, the abdominal wall muscle gets weakened. So when age advances, it is a risk factor. And for a inguinal hernia, male gender is a risk factor because cord structure has to go through it. So, and for a umbilical hernia and an insertional hernia, both are equal incidence, but female, because of multiple pregnancies and sterilization, puerperal sterilization, the risk of insertional hernia and umbilical hernia are higher. Femoral hernias are even higher in females, and anything which increases the intra-abdominal pressure constantly, So when the patient is having chronic cough due to allergy or TB or anything else, if there is a continuous chronic cough, the intra-abdominal pressure is keep on increasing for a longer duration, or there is constipation. The patient constipates daily, for which he has to strain for stools, the intra-abdominal pressure increases. And weightlifting, maybe professional weightlifter or a gym person who is having a constant weightlifting activities in his day-to-day life. All these persons, when the intra-abdominal pressure is constantly increased, the pressure finds some way of weakest point, which will cause a herniation of that weakest point. It can be umbilical hernia or a inguinal hernia. Or smoking is a risk factor. So smoking, strong collagen is being replaced by a weaker collagen. So the connective tissue becomes weaker. So it can cause hernia. So
It's quite interesting to know that smoking and also can be a risk factor for hernia. And you have already mentioned that obesity is one
also
more
a
cause.
risk factor.
And you explained the whole thing also. So
All these are risk factors. They don't guarantee hernia, but they stalk the odds.
But does a hereditary factor or a familial history
Yes, ma'am.
increase the risk?
Yes.
Yeah. Okay.
So if you see most of the very fit gym going persons, some persons develop hernia and they come to us, and some person doesn't develop hernia.
Yeah, I know.
The difference is they have a genetically weaker collagen. It doesn't mean they are weak. They might have a core muscle strengthened, but the connective tissue is weaker. And that weaker point, when once they do daily activity, intra-abdominal pressure increase, it develops into hernia.
Oh, that's unfortunate.
So genetic also plays a role in hernia.
But if you have now for example, there's somebody in the family who's got it, and then you know that there is a genetic predisposition, and you want to, take care of yourself, what would you do?
So to avoid it, basically, they should not strain for anything.
Oh,
Strain for anything in the sense constantly.
constantly.
If they are having cough or if they are asthmatic by thing, they have to see to that they don't get into allergic situations. And in case of a genetic predisposition or some person in a family having hernia, so if you are worried that you might also develop hernia, then it is better to avoid all activities of weightlifting. And you try to make over your meal plan so that you don't constipate. All this stuff, and try to reduce your obesity, keep it in a good BMI, and that will itself.
So general well-being itself will take you a long way then.
then.
Okay, that's a nice thing to say. And then what we see is sometimes they have a very mild form of herniation, which is not bothering them too much. But yeah, when they cough or something, they tend to come and say that I have seen this happen. So is it normal or no? So in that case, what would you advise?
Ma'am, if you, in that case, if it is a small hernia, and if it is reducible, and if the defect is very small, then you can wait for surgery. You can go for wait and watch. But obviously, at one point of time, if it is a younger patient at a longer age, it is going to develop into another large hernia. So in that time, operating for a large hernia will be difficult. For a small hernia, it is easier for them to operate. Post-operative recovery is also good. So in that case, we prefer to do it as soon as possible. For hernia, it is always surgery. What I personally prefer.
And we have seen a lot of cases that even after surgery, they have recurrences. So what would you advise so that the recurrences do not happen?
So basically what we do is surgery for hernia is either open, lap or robotic, whatever it is, we are closing the defect and we are placing a mesh. Mesh is a very thin 0.5 mm thickness sheet that is not going to give protection for this hernia. So it has to get incorporated into the muscle and integrate, so that then only this it can give a full protection. So that takes a longer time. It is not like that I come today, operate tomorrow and go to work as I have cleared of hernia. Once we keep the mesh, it takes 7 days for it to stay in place,
Okay.
and all the
Yeah, all the tissue around has
tissue
to
around
develop
it
and hold it in
develop and hold
position.
it up. So by 1 week it will get holded.
Okay.
So by this time the patient can drive, he can walk, he can climb stairs, he can do all his day-to-day activities
Okay.
except weightlifting.
Okay.
And by 3 months it get incorporated into tissue. Our
All
tissue
right.
starts growing into this mesh fibers and around the mesh fibers, and it gets inculcated, which forms a biological bond between the mesh and the anterabdominal wall. This is going to take 3 months,
Okay.
and by 6 months it will get integrated into the muscle,
Okay.
so which will start acting along with the muscle.
So even if you do a surgery, you have to be
to
careful up to 6 months. Okay.
I ideally prefer to say patients that you should not lift heavy weights for 9 months.
Okay. Yeah. To make
So
it more
ideally for 3 months.
Okay.
For sure, no weightlifting for 3 months. The problem with recurrence is, even though there are surgical techniques is also a very important thing, and the mesh wash we keep, in what plane we keep, everything has a role. But even then, the most of the time the recurrence comes because once operated, patient goes again to work, he starts lifting heavy weight. That is the problem, because it is not yet incorporated and it is not yet giving strength to the muscle to hold this. So that time it will find another weaker way and it will form into
that's so sad,
recurrent
yeah.
hernia. That is what.
So in their cases, is there some belt or some kind of reinforcement which
yes,
can be done
yes, ma'am.
to help them?
Yes, ma'am. For inguinal hernia, there is no belt, madam. For umbilical hernia, after surgery, for 3 months, we advise them to wear abdominal belts. So whatever they would have worn in their pregnancy, we will ask them to wear it, so that it also gives a external pressure.
And when can they start exercises? If it's inguinal hernia, when can they start? And umbilical hernia, when can they start?
For both hernias, ventral hernia, umbilical hernia, or inguinal hernia, after 7 days, once they get relieved of pain, then they can go to day-to-day activity, all work. From 1 week to 3 months, it is walking, cycling, swimming, and if they want to do real workout, they can go for either pull-ups, push-ups.
Okay.
No squatting, no
Okay.
weightlifting.
Okay.
Should be there for 3 months, and that itself will prevent most of the recurrence.
Okay. So their exercises are advised, but you have to be very cautious and not do certain exercises like squatting or bothering
Or weightlifting, deadlifting, and all totally they have to avoid it. Even if they are a gym professional also, they have to avoid it for 3 months.
Okay. So now if a recurrence has occurred, then when do you advise the patient to come to you? Because if a recurrence has occurred, probably it starts a little slow, right? It's not like immediately it's gone back to normal, the same old one. So what do you advise in the case like that?
Yeah, usually we see recurrence usually in the second year or first year.
Okay.
First year to it is a longer duration. So first initial 1 year, the patient coming to us with recurrence is very rare. After 1 or 2 years, the patient can come. So if the patient comes to us with recurrence, again the option is only surgery.
Okay.
If it is done in an open method, then we will prefer for a laparoscopic method for a recurrence. And if it is done in a laparoscopic method, we will go for an open method.
Okay.
So that the plane totally differs, and it will be easier for us to operate.
Okay. And do you think that sexual activity is going to increase the recurrence after a surgery?
No, ma'am. It is not going to affect anyway. As we said, within a week the patient can go for his day-to-day activity. Within 2 weeks or 3 weeks, if the patient is sexually active, he can continue with his sexual activity. That is not going to bother.
So that's not a reason. And you know, from all we hear or all we study also, hernia is more a male thing.
Yes.
It affects the men more, and it bothers the men more. So how much does it bother a woman?
The problem is, ma'am, hernia is thought to be a male kind of thing, because around 15 to 25% of the male develops inguinal hernia, which means 1 in 4 or 1 in 5 of the male is going to develop an inguinal hernia in his lifetime.
Oh, that's really high.
That is the statistics what says, ma'am. And inguinal hernia in a female is 1 to 3%.
Okay.
And but when it comes to umbilical hernia, it is equal,
Yeah.
incidence is equal on both sides. But because this inguinal hernia is very common in male, it is being taught as a
Disease of the
male
men.
disease,
Yeah.
but it is really a disease of both male and female.
Okay.
Both of them are advised to do surgery.
Okay. So now, if there is a little bulge, and then how you can't, like, everything cannot be considered or categorized as hernia, right? So if somebody is like paranoid, oh my God, I might be having hernia. How would you comfort them? Like saying, okay, if you don't have this, then don't worry.
Okay. So most of the time anterior abdominal wall, there can be a lipoma which can also come to us with a swelling.
Okay.
But if you are worried and if you have no time to go to doctor, you just present see it. If it is going inside, then it is a hernia.
You're still safe. Okay.
It is
You're
a hernia.
Okay, it is a hernia. Okay.
And if it is not going in, it must be a lump. It can be a lipoma or sebaceous cyst, whatever.
Okay.
It can be in the anterior abdominal wall. But once you do activities, if it is increasing in size, and once you lie down, it goes inside by itself, then it is surely a hernia.
Hernia. Yeah. But then when should they run to the doctor?
Yeah. So when to go to a doctor? The patient has to go to a doctor immediately if the patient is having pain in the region, and when the patient push it back, if it is not going inside,
Okay.
which means that it has become irreducible, or if the patient is having the hernia is not going inside, along with that the patient is having vomiting or constipation and obstipation, which means the patient is not able to pass flatus and motion.
Oh, okay.
In all this condition, which means that this hernia has got and stuck inside the hernial sac.
Okay.
So when to go to a doctor is when the patient develops pain, vomiting, and the hernia is irreducible, which means if the patient is pushing the hernia and it is not going inside, and if the patient is not able to pass flatus and motion, and there is abdominal distension, then the patient has to run immediately to the hospital. Basically, we do surgeries for hernia because to prevent complication, because this hernia is not going to cause pain. It is going to be a dull aching pain. It is not going to be excruciating pain. So pain is not a problem. A mild discomfort can be there. Even then we operate for a small hernia because to prevent the complication. Even though complication is only 1 to 3%, the complication could be strangulation and irreducibility. We do operate because that is going to cause a very serious complication.
Okay.
So even though it is 1 to 3% and it is not nil and it is going to cause a threatened complication, we are operating an hernia to prevent that complication.
Okay.
So
when do you know there is a complication? I mean,
these
for a
are all
person
the,
to understand that, oh my God, I've developed a complication with hernia, I got to really see a doctor.
The warning signs for a complication is pain, vomiting. Along with that, the hernia is not going inside or it is irreducible, and abdominal distension, not able to pass motion and pass flatus. So
pain, to what degree of pain would you say?
It will be
quite a severe pain, right?
It will be a severe
because
pain.
is very relatable, right? Some people can tolerate more pain and some people can tolerate lesser.
This pain is going to be a severe pain because it is due to the reduced blood supply to the bowel or the momentum.
Okay, so that's going to be excruciating a pain, yeah. So there are so many myths about hernia.
Yes.
So let's break some of the myths.
Okay.
One would be, people just imagine that if you have hernia, if you don't do any physical activity or you don't strain it any further, it will become all right. How wishful a thinking, right? But okay, please break them. Tell me.
Not lifting the weight might not worsen the hernia, but it is not surely going to completely cure
it. Okay. So that's surely a myth. So you have to handle it. And then some people believe that if you push it inside, it will go inside, so it will stay inside.
Yeah, but the patient would have tried it for
many times,
ma'am, and it would have not gone in.
True.
That so myth, the patient himself will understand. It is not going to go inside. Even after so much of pushing, it is not going to go inside.
And people believe that there are exercises which can reduce hernia.
Yeah, I've also seen a lot of exercise, lot of
Yeah.
drugs saying that if you do this exercise, it will surely core strengthening exercise is going to be good for your back
Okay.
and it is going to strengthen your muscle, but surely it is not going to close this hole.
Okay.
So only option will be doing a surgery.
This is not because of the muscle, which
Muscle
is
weakness. It is not
yeah.
due to the. It is a weakness of the connective tissue.
Yeah.
You can
And that
strengthen
is
your
not
core.
in anybody's hands actually.
Even
That's
if
very
you-
unfortunate, right?
Yes, ma'am. Even if you do exercise, your core muscle will get strengthened, but this connective tissue which is weakened and already with a preformed sac is not going to get correct.
Now we say connective tissue. There are so many drugs which say they build connective tissue and they can help with
Yeah.
collagen resynthesis and all those things and all. So will that help in this?
No, ma'am. It is
No,
not
not at
going
all.
to help.
Okay. So that's again a myth. Hernia occurs only in older people, is it?
No, ma'am. It can occur even in a newborn preterm baby.
Oh yeah.
It is a disease of
Any
all age group
all age.
and all gender.
And you said obesity can cause, but then if it has come, then reducing the weight will revert it to something people believe in, right?
Yes.
So
there is a myth that if you reduce weight, this hernia will get cured, but it is not going to get cured. But reducing weight will be very helpful in doing in the recovery of the surgery and intraoperatively also. It is going to help. So if there is a obese patient with a large hernia, we do advise them to go reduce the weight to 10% of their body weight and come back, so that the procedure and the post-operative recovery, everything will be good.
okay, that's what can be helped, but not the hernia per se.
It cannot as such clear the hernia.
So you were talking about different techniques for surgical techniques for the hernia. So I mean, who is the ideal candidate for a laparoscopic hernia surgery, and who is and then why open hernia surgery?
So anybody is ideal candidate for laparoscopic surgery.
Okay, that's a small procedure.
Yeah, it has been done as open procedure. Even though open surgeries are time tested and gold standard, this laparoscopic surgery is overtaken it. And right now laparoscopic surgery there is no restriction for obesity or something like that. Is not a restriction for laparoscopic surgery, but recurrent hernia from a laparoscopic surgery, I personally usually prefer an open surgery.
Yeah, then you have to really figure out where exactly the flaw is and then seal it. In lap, you cannot do that, right? Yeah.
So there is no contraindication or no person is. Only problem is when we go for a open hernia, it is only a spinal, and if we go for a laparoscopic hernia, it is going to be a general anesthesia. If the patient is fit enough for a general anesthesia, he is fit enough for laparoscopic and robotic surgery.
That was a wonderful conversation, Dr. Sethukannan. Thanks a lot for explaining in detail only about hernias and so many things. I think some things which we have heard, some things which we never knew. So there are a lot of information given. Thanks a lot, Doctor.
Thank you, ma'am. Thank you.